Welcome to the Medical Support to Irregular Warfare podcast, an initiative to discuss and educate the evolution of medical support in peace, security, and conflict in uncommon environments. Points, perspectives, and opinions voiced here are solely those of the contributors and do not represent any formal association or government entity. We do everything possible to ensure the information and discussion is sound, comprehensive, and from the most credible sources. Ladies and gentlemen, welcome to the MSIW podcast, and today we would like to have a discussion about medical messaging in this information age and hopefully provide a fuller understanding of the risk, principles in use, and how any messaging affects the larger picture, both good and bad. Why is this important? Because this is risk, and a single mistake or misspoken word can have policy effects, again, good or bad. Let's start with the fact that our community enjoys a great deal of trust. We've earned that, and we have to earn it every day. Through our competencies, professionalism, and our MLE, moral, legal, and ethical standards. And through transparency. If we cannot do something, we say so. If we do something wrong, we say so, and we police ourselves. This is all good, but there is risk to our reputation almost every day in messaging. Just some facts to today's era of news and information flow. Information occurs immediately, much different than just 15 years ago. As soon as anything is sent from any cell phone or platform, it has immediate effect and is no longer within control. 53% of plugged American population receives their news through social media, and that number is growing. That means no filter, no standards, and several nations have now even banned social media for teenagers due to misinformation, negative effects, and risk. Let's speak real quickly about the strategic corporal redefined. This was a term we used in Afghanistan and Iraq a great deal, noting how the lowest level of leadership has operational responsibilities in representation. Arguably, this is redefined now because those lower level effects, again, good and bad, won't just have tactical or operational impact, but also strategic and political impact. Two quick examples, an old and a recent one for you. A good question for my generation is always, what was America's greatest defeat in the global war on terror? Many argue that it was Abu Ghraib. Abu Ghraib was a detention center managed by American troops who had harassed detainees and abused their power. And then they documented it in pictures. And those pictures had immeasurable political, strategic, and cultural cost to our efforts. And they had and should have had consequences. That defeat we did to ourselves. More recently, within just the past month, the images of a soldier of another nation taking a sledgehammer to a religious crucifix. Again, this is political impact that cannot be reversed. Of course, there's patient privacy, clearance, approvals, and consolidation of messaging within a command formally. But this episode is meant to provide some clarity and understanding from expertise for the community, because we need to all think about messaging at all times. Perception is reality. With that, I'd like to introduce our guest for today, Dr. John Torres. Dr. Torres had a 32-plus year military career as an Air Force emergency medicine physician, flight surgeon, and even as a pilot. Currently, he serves as senior medical contributor to NBC News, as well as faculty to University College Cork Security and Defense Medicine program. So great insight to give us perspective. John, thanks for being here, sir.
Yeah, and Mike, thanks for having me here. And I think a lot of the things you said hit the nail on the head. And thank you so much for talking about this, because this is a topic that tends not to be talked about much, mainly because a lot of people either don't understand or don't put it into their toolbox. But it is a thing that could definitely trip you up. It could also help you.
Absolutely, and use it to great benefit as well. And I know I sounded a little bit alarmist probably in the introduction there, and I hope you'll balance us out in that. I've got a couple questions, though, just to introduce you, if that's okay.
Definitely.
Pilot and physician, how did that happen?
So I went to the Air Force Academy, and I started off as a pilot. So after the academy, went to pilot training, flew for 8 years, flew C-130s and some other aircraft. And at about the 4-year point I met somebody that was going to med school, and I started talking to them. I thought, I remember back in high school, that was always a dream, a pipe dream in the back of my mind. I thought, why not try it? Why not do something that I've always really wanted to do? Even though being a pilot was fantastic, was fun. I did a special operations airplane that we had tons of missions, and we did, great work, but we also had a good time doing it. Moved on to medicine, and that was definitely my calling, and I've been doing that ever since. And definitely was a struggle. Had a wife, had 2 children at the time, and so went through all that issues to get to med school, go through med school. It's a long haul, but once I finished it, went back into the National Guard, the Air National Guard, and did that for the remainder of my career. And like you said, 32 plus years of doing all that, and it's just been fantastic. I couldn't have asked for a better career.
I'm sure there's no regrets there, and to hit every base that you want to, I mean, that's you can't ask for more than in life than that, right?
Exactly.
I gotta ask you, everybody's gonna be interested. You work for NBC News. That's a big deal. Can you give us just a little bit of insight or, how much you enjoy that?
Oh, that's fantastic. And for about a 5 to 7 year period, I was what they call chief medical or senior medical correspondent. So I was the full-time doctor for NBC. I started in 2015. Up until 2020, things were going as normal with correspondence, doing stories occasionally here and there. And then 2020, March of 2020, obviously, the pandemic struck. And as one person put it, that was essentially my Super Bowl. That was when I ended up being on air countless times. My record, 27 times in one day, 5 different subjects. And if you remember back, especially the early part of the pandemic, it was essentially the information changing. We'd find out something in the morning, and 5 hours later, something contradicted that. And so I'd go on TV and constantly talk about that. One of my mandates when I first went to NBC was I am only going to do things and say things that are scientifically sound. If I give you my opinion, which I will, I'll tell you this is my opinion. It's based on what I think so far, but it could change. And if information changes, which it does, I was very easy to go on air and say, what I talked about 3 days ago no longer applies. Here's why. And fess up to the misinformation I had done 3 days ago based on the information I had at the time and how that had changed. But essentially, and for me, even to this day, we're talking 6 years later, I have people stop me in different parts of the world, surprisingly, and just say thank you for helping get us through the pandemic. And that is an unbelievable feeling that I was able to get that messaging out, that medical media messaging out to people that, essentially they say it helped them understand why they needed a vaccine, why they were doing these things to help save their life. And it's just a good feeling to be able to do that. And to be able to do it at the level, it's a huge platform. It's a platform that you have to take very seriously, has a huge public health importance behind it. But at the same time, I also understand I have the ability to give people information that could hurt them if I was inclined to do that. And I'm not. It's one of those things. I stuck to my ethics, I stuck to my beliefs, and I stuck to the scientific principles that I understood at the time to give you the information out, Mike.
I love that you brought up transparency because that is an indicator and it earns trust every single time, especially
Definitely.
with doctors.
Yeah.
And I know those were rough days, especially for the medical service and profession. And I don't think we've still appreciated quite what we went through, but thank you for everything you did during that time.
And, just to bring up a point, you brought up a point about misinformation, and that is true. There was a lot of misinformation there. But the one thing, and we'll delve into this a little bit, is also that to me, even more terrifying was the disinformation that was out there. And the difference being, for those who don't understand, misinformation is I truly believe this is the information, even though it's wrong information, I truly believe it's information that's appropriate. And I'm giving it to you. Disinformation means I am trying to give you information that is wrong. And I know it's wrong, but I'm trying to trip you up on some point. And, if you look at the media messaging that's worked around the world and hasn't worked, you've seen a lot of that disinformation. And, particularly now in 2026.
Yes, sir. And even before on a podcast with Dave Maxwell, he spoke highly about how influence operations within misinformation can really negate, those medical efforts. Just starting out at the basics, what does medical messaging actually mean? What are your thoughts on that?
So medical messaging means exactly that is, getting that medical message out. If you look at Maslow's hierarchy, and Maslow's hierarchy is essentially a pyramid of things we need in order to survive. And if you look at the bottom of the pyramid, the main foundation, it has psychological there. And in psychological, health is one of the most important things we need. Food, shelter, water, health, those types of things, clothing. Because of that, people get very, very interested in their health and they want to make sure they're doing the right thing, but they also easily get very scared about doing the wrong thing. And that's where that mis and disinformation comes in, because with medical media messaging, you are able to affect not just people, but populations. And when you start affecting populations, they want to make sure that they're being taken care of and the people around them they love are being taken care of. And if that's not happening, then they're going to lose faith and they're going to lose trust in whoever is supposed to be supplying that care for them. It could be their government. It could be whatever agency is there helping them out, and they're going to look somewhere else. And there have been many, many examples of governments falling apart because they weren't, quote unquote, taking care of people, but it was actually people not believing they weren't being taken care of. And so that's where that medical, the media messaging is important. The medical messaging is a component of that I think is top of that importance, because people at the fundamental level, they want their health taken care of and the health of their loved ones, but they don't really understand necessarily what that means. And so they're looking at others to supply them the information. And if it's supplied from somebody who we don't want necessarily to be their government, but they're starting to trust in that aspect of their government, then that's where they're going to go with, and their hearts and minds are going to head in that direction.
Yes, sir. MSIW podcast, I'm going to ask you a little bit about irregular warfare. And you've lectured on this before at conferences. You teach military assistance programs with medical seminars, those types of effects in partner operations. Give us some thoughts on how does the medical messaging work, especially in this new or redefined irregular warfare scenario?
And that's one of the things that, to be honest, 3-4 years ago, it wasn't a part of that military assistance talk or military assistance course that we gave, because it wasn't something that we really thought that much about. We talked about public relations, information operations, that kind of thing, but never really as far as what that medical media messaging meant and how powerful that could be. And especially when it comes to IW, UW type situations, because what is happening is especially special forces units, as you know, Mike, and everybody talks about, these special forces units, they might be tactical units, but they can have operational and strategic effects. And that could be good, that could be not good, depending on how that messaging gets across, and particularly that medical messaging. One example I can give you is in Pakistan, when we found Osama bin Laden and he ended up getting killed a few days later. It was because of a hepatitis B vaccine program that was going on there. Well, it turned out, information got out that a hepatitis B vaccine program was actually funded by the CIA, and it ended up being a bad medical messaging in that point. And because of that, they ended up stopping not just the hepatitis B vaccine program, but also polio vaccine program. And they ended up, unfortunately, killing a lot of healthcare workers, imprisoning other ones. And it basically just destroyed the public health initiatives in that area. And it turned the trust of the population against the government at the time. And so again, that in IW, UW situations, the special forces are going in there. They're trying to work with indigenous populations, resistance populations, those types of things. But they also have to understand that those populations need public support. And if they get the wrong message out there, that public support's going to erode. If they get the right message out there, especially the medical messaging, that population is going to start supporting that resistance. And that's the important part behind UW and IW with this medical media messaging, because again, that's an important component to them. They want to make sure the population at the bottom line wants to make sure that if they do something, if they have an uprising against this government, that they have somebody in place who's going to be able to take care of them. And that's where that messaging comes in.
Yes, sir. I often repeat myself saying that SOFA is the most political force in the world. And, not because they act on politics, because their impact is political. So being hypersensitive, being hyper cautious, asking when we're unsure about, these programs or messaging is always good advice.
Yeah, I think it's fantastic advice and good advice. And, again, when it comes to this UW-IW environment, part of these partisan troops, UW, these resistance populations that are out there, they can't do what they do without the support of the whole population. And one of the things I talk about, it's a bit of a parallel, but not completely analogous to it. But if you look at Pablo Escobar back in Colombia, and I frequently bring him up because my wife is Colombian, And one of the things I talk about is one day I was talking to her uncle, and he was I think in his 70s, and we had gone to the Colombian National Police Museum, and in there they talked about Pablo Escobar, and they had a room dedicated to how they ended up getting Pablo Escobar. And I went back to the house, and we were staying with them, and I that evening at supper I mentioned to him, I said, "Oh, we went, got there, saw the Pablo Escobar thing. Thank goodness they got him, all that stuff." I thought the uncle was going to come unglued. He was like, "Are you kidding me? That man should be our president. That man was the only one that took care of us." And what he did is he ended up getting out there and putting up clinics, sending people to medical school, putting up schools in particular. He was taking care of the population. And you can imagine taking that a step forward in 2026, taking care of that population, but also getting the messaging out that, hey, if you need help, you come to me and my people. And that's why he was able to hide for so many years. And so that's analogous to what's happening in different parts of the world and what Special Forces is working with. They go in there, sometimes covertly, sometimes overtly, working with these, the resistance, the partisans, whoever you want to talk about. And they need to make sure that those units, those populations are getting the right information out there. So again, they can get that population support.
Yes, sir. Escobar definitely read Shay's book on the matter, who was a doctor himself. So that's huge messaging. You brought up kind of a bad medical messaging before, and you just brought up a great, good example. What are some other wins that we might just glean off of?
So some other wins is back in the after World War II, Malaya, which is now Malaysia, but Malaya at the time it was occupied by the British, and they went in there and they were having a lot of issues because they were being a bit oppressive and they were causing some issues with the population. So the population started turning towards the Malayan Communist Party, and the Malayan Communist Party was starting to take over and starting to make inroads. And they had what's called the Briggs effect. Went in there, one of their officers went in there and he said, "Hey, what we need to do," it was their commander, "we need to make sure that we start giving the Malayans what they need. We start giving them health care. We start building clinics. We start cleaning out their villages, all that stuff." Once they started doing that and getting the message out that, hey, we're the ones taking care of you, they ended up also chasing out the Malayan Communist Party. They basically essentially said, hey, we trust in these guys. We don't trust in the Malayan Communists because they're not really helping us. And again, that's that hierarchy we're talking about the needs being met of the population. Fast forward to Vietnam, we had MedCap ones, which were the U.S. Green Berets, were going into these indigenous villages, and they were helping not just the villagers because they were living with them, they were also setting up clinics and getting the word out that, hey, if you need help, these are the people to take care of you. And so they're able to make a lot of inroads in that area. Unfortunately, it fell apart with MedCap 2, which the conventional forces came in and they started doing what we call the dropping the tailgate kind of MedCaps, which didn't work as well. But historically, you can see these things going on and on as far as the successes that have built over time here.
Excellent, sir. You teach a program on military medical assistance, military medical engagements. When we talk about medical messaging, what does good medical messaging look like in medical seminars, the medical civil affairs programs of the old?
So you brought up a great word earlier on, and it all comes down to trust. And that's where the medical media messaging comes down to is trust. Who are they going to trust? Who are they not going to trust? The best example I can give you of where trust went one way and not the other, it was if you look at the pandemic and who won the medical media messaging in the pandemic. And essentially, if you look at it, it was the call it what you want, vaccine hesitant community, anti-vax community. They definitely wanted the medical messaging. Why? What happened there and what went askew. And this is, what I teach and what I think is important to understand is first and foremost, you have to be able to build that trust. And that trust building starts before you even go on these missions, before you go there, that you are able to essentially get some messages out there about what's happening and how things are working. Now, granted, especially with special forces, you're doing a lot of these things with one hand tied behind your back because of OPSEC issues and OPSEC concerns, which are valid concerns. The adversaries are not. They don't have those concerns. And so they're able to get out any information, any misinformation, any disinformation they want. And countering that is always hard. And it's like I talk about, like a lot of things in medicine, once you start getting behind the 8 ball with, let's say, seasonal allergies, it's hard to catch up on seasonal allergies. You want to start ahead. Well, similar here with media messaging. Once you start getting behind the 8 ball with media messaging, it's hard to catch up on that. COVID being the opportune thing. The adversaries would come out with a message about, these vaccines are hurting children. Well, then 3 weeks later, the government agencies, CDC, FDA, NIH, all those agencies here in the US would come out with a message going, "We have looked at a study and it turns out that there's, no harm done with these." And myocarditis is the biggest example. If you look at myocarditis, it was very, very few cases, very limited to who got it. And overall, the risk benefit was much more in the benefit category than the risk category. But the information had already gotten out that the vaccines were causing heart issues and killing people. And so you can imagine how that over time can multiply and amplify with not just that message, but other messages as well. So essentially it's number one, try to gain that trust beforehand, and not necessarily much like I teach in medical assistance thing. It's you're not doing it your own self necessarily. You're helping guide whoever you're working with. You're helping guide them into how to get that messaging out there, and just looking over what they're doing to see if they're doing it in what you consider appropriately, and giving them advice on how to change that. So because you want them to get the credit for all this, not you, but them in these MA type situations. So you want to gain that trust. Also understanding that speed is essential when it comes to social media. Like you mentioned, the vast majority of people are now getting most of their news through social media. And if you go through all these social media platforms, you see things change very quickly and get put on there very quickly. And again, the biggest example is, COVID pandemic. The government would always take weeks to get information out there, and they would give information on a scientific basis, which, like I mentioned, is one of my prime directives, is to be able to do that. But at the same time, they are battling an adversary who is putting information out there on an emotional perspective. And that emotional perspective weighs much more heavily on people than the scientific perspective does. And so trying to balance that out, that's difficult. There's no straight answers on how to do that. But at the same time, trying to counter what they're doing, trying to anticipate what they're going to do, trying to put out the information saying, hey, you're going to hear this from them about how these vaccines might affect this. That's not true. Here's the truth behind it. Very limited amount of myocarditis for that example, but the vaccine still protects people from from being in a hospital. And then essentially just having that one trusted voice. But that one trusted voice, there's actually an interesting saying, podiums don't travel very well. And so the one trusted voice should not be the head of a government agency, the head of a government department, the head of anything behind a podium, because that's an authority. And people don't, these days particularly, don't necessarily trust that authority figure. What they will trust, and we're seeing this in Ukraine, they're doing a fantastic job, and they are definitely winning media medical messaging war front right now, which is great. But what they're doing is they are having people from the front lines. They are having that frontline medic out there giving out information, going on the social media platforms, telling them what they're doing. And you and I have seen these videos and been in these presentations where they'll send one of their medics to give this presentation, not the three-star general from their health department. It's because people trust the guy, the person, the woman whose boots are on the ground doing this kind of work. So get that, and then stick with that person, because that person starts building trust after a while. And also, huge important thing to talk about, be able to switch and say, hey, what we talked about 3 days ago, it's not as accurate as I would have liked it to have been. Here's the actual accurate information, and here's why it's changed, just so you know, because otherwise you lose trust in people. And if you lose trust in people, you're done.
Great examples and very worthwhile and beneficial. I hope we take up some of those protocols or practices that we're seeing across the pond right now within NATO or across the Pacific or whatever. There's a lot to learn from there.
Definitely.
John, you very often kind of close your lectures or your discussions on medical messaging with 5 takeaways. I'd like to hit you with each one and just let you give us some thoughts on it. Medical actions are information actions.
Right. And essentially, anything you do, and we know this from just the perspective of anything we do in the military environment in particular, has huge implications. And if that message gets out, it has huge possibilities, and both negative and positive. And like you mentioned, in the Israeli war right now, there's that Israeli soldier who is taking a sledgehammer to a crucifix. That went worldwide in a matter of minutes, and all of a sudden it's huge bad public relations right there on what's going on. So, one of the big things to remember is that you're gonna have these huge footprints out there, even though you don't necessarily think you're gonna have these footprints. And again, like I mentioned, the hands are a bit you're doing this with the one hand a bit tied behind your back because most special forces personnel don't typically get on social media because they're trying to protect themselves and their families. At the same time, others can get on social media. You can certainly leverage that. You can leverage other people to bring them in to help you out with that. And even for those who are listening to this who aren't necessarily special forces, whether you're civilian, whether you're military, getting that media messaging out there is extremely important to get your points across and to win those hearts and minds that are out there.
Thank you, sir. Your next one, medical neutrality is your most expensive asset.
So with that, it means essentially, and it was interesting because when you mentioned Soma, when we were at Soma, was talking to an individual there, and they were saying, we think a lot of times of a lot of these NGOs as being medically neutral. It's almost impossible to be medically neutral. And a lot of these NGOs, even though they say they're medically neutral, they are putting themselves up in an area where they tend to be taking care of one faction versus the other faction. They're helping them more. They don't really even put themselves in an area where they might be helping the adversary faction. And so they're not necessarily neutral, but trying to keep that neutrality as much as possible and trying to get people to understand, hey, my job here is to keep you as safe as possible. Example again, going back to that Pakistan example I gave you with finding Osama bin Laden, you never want to use medical assets or medical missions to try and push a military intelligence type agenda because that could certainly backfire on you like it did there, where they use this because they knew they can get in. And that's one of the things that I always bring up in the military assistance course is medicine is a great foot in the door because every country, regardless, if I went in there and I said, "Hey, I want to teach you guys how to shoot guns and shoot mortars and kill other people," there'd be a little hesitancy. If I go in and say, "Hey, I want to bring in healthcare to your people and teach them how to make sure they can survive any incident that might happen," they're more than welcome to open. They're more than happy to open the doors and bring us in. So it's a footprint in there. It's a step in the door, which is very tempting to use for other purposes. You have to be very careful about that. And always think in the back of your mind, if this message got out, what would it look like? And is there a way we can counter that? Or if we can't counter it, then do we need to think again about how we should be doing this?
Yes, sir. Absolutely. Your last one you've hit already, and I think we'll agree that we've really only learned this about 20 years ago. Partner force is always the most visible authority.
And that's the bottom line behind the military assistance and behind when you talk about this UWIW type situation. It's if you look again back at MedCap 1, the Green Berets were going into these villages. They were taking care of the villagers. They were helping them set up clinics, but they were letting them get all the benefit behind it. And so they were able to go in there and get the benefit, which means the population started looking at them going, "Oh, our own people are taking care of us. It's not Westerners or it's not outside influences taking care of us." Unfortunately, that fell apart in MedCap 2, and this is probably one of the better examples. In MedCap 2, conventional forces came in, and they started doing what we used to call dropping the tailgate. So you go to a village, you drop a tailgate, you give out vitamins and shots, pull up a tailgate, and go to the next village the next day. What does that do? What does that do? Well, that degrades the population's confidence in their own healthcare providers because they want that Western doctor here. That's the person who took care of me. So ideally, what you would want to do is go in there, teach the healthcare providers there how to do things, and then take a step back, be in the back room, let them do their thing, and they are completely the face of any type of situation you have going on. In a UWIW environment, that's even more important because you are trying to get the population to support them. And so getting them to get what the population needs out there, but they are the face of that is ultra important, making sure you take a step back and you get no credit for it. Otherwise, you start eroding the confidence in the people you're trying to get confidence in.
You brought up disinformation before, and one of your last points here is pre-bunk before disinformation lands, and that's kind of new territory for our conversation.
It is, and it's not that easy to do, but oftentimes you start having information about something that's going to happen. And anytime you do something, you need to start thinking about, okay, how could this either be spoken, told wrong, shown wrong, social media wise wrong videos or whatever. And if you're doing any kind of healthcare seminar situation, clinic, whatever, again, you want to think about, okay, is there certain video or a certain thing that the adversaries could use and take a snapshot? And we've all seen those videos and pictures that are taken completely out of context. Is there something they can do that could be taken out of context? And if there is, and especially if you find out about it beforehand, don't sit on your hands and wait for it to come out, because again, you're behind the eight ball at that point. You want to jump on it quickly. You want to go in there and you want to say, hey, listen, we did this, we were working with these personnel from this one village. They put up a seminar. In the seminar, somebody might, during one of the needle injections, accidentally bled a little bit. That's common. That happens, and that's not a bad thing. It stopped immediately, no problem. So when the information comes out, you've already started to step on that fire and put it under control instead of waiting for it to turn to this big fire about how all the vaccines we're giving are making people bleed out and they're all dying. You want to take care of it beforehand and try to debunk it before it happens. Easy to do, easier to do if you have that trusted voice with you, that trusted person that has been doing this for a while and is the face of whatever you're working on. That's from that entity, that population you're trying to encourage, that population you're trying to help. You have that medic talking, that medic debunking it. People trust that medic, and it still might get out, but it's much better than what happened. And we saw, again, going back to COVID with the vaccine hesitant versus the government entities information. There is, the government would typically take days to get information out there, and then they would give information that was either contradictory to what they had said before or very hard to understand. And that's the other thing, Mike, is you want to make sure that you're talking on their level and not talking at a medical perspective, which is why getting it down to that level on the ground. These are people who are talking to the patients, and they know what the patients want to hear, how to address the patients, how to talk to them in their language, instead of going to the administrators in whatever area you're in, and they're talking from an administrator perspective of something that number one, a lot of people won't understand, and number two, a lot of people won't trust.
A real person vice the policy level type of
Exactly.
impact. I love your points there about red teaming, though. Red teaming your medical messaging concepts and your plan, murderboarding those, playing devil's advocate on yourself, and how can they be turned around on you. I hope I'm sliding in right into the last point here very well for you. But you took a really great lesson from the vaccine skeptical movement. Could you share that with us?
Yeah, and the big lesson from them is essentially a variety of things. Is number one, they're going to hit people on that emotional level. They're going to hit them with misinformation and disinformation. So you trying to counter that with science is appropriate, but you also have to put it in a emotional level as well, and not necessarily getting down to the level they're at, which could be that mis or disinformation, but essentially getting on the level. Example I can give you, you know, my, myocarditis. I keep bringing that back up because it was a prime example in the pandemic. Is the vaccine hesitant community, the anti-vax community, they had, they had basically glommed onto this bit of information that a COVID vaccine, had caused myocarditis in young adult males. It had. It was a handful of young adult males that had gotten myocarditis, but the way they presented it, it seemed like it was very common and happening commonly and was causing deaths and causing all sorts of issues. They presented it as the COVID vaccine is going to cause heart problems and cause deaths, so you don't want to get the COVID vaccine. What I ended up doing is going on and saying, hey, listen, this happened, but here are the actual numbers of who it happened. And I can't recall them off the top of my head, but it wasn't many that actually got myocarditis. It was males in this young age group, up to age 18 to 24 age group. So it was very limited males getting this one specific vaccine. They got it. They went to the hospital. They recovered. The only ones that didn't recover, that ended up dying, were ones who ended up having pre-existing heart conditions, which was already a contraindication to getting the vaccine. And so again, it's one of those things of, hey, trying to put out the information there. And then what I added was that emotional component to it of, listen, the vaccine, I'm telling you here, is one of those things that it won't necessarily cause you to not be able to pass it on. So it's not the kind of vaccine that's going to stop you from getting infection. It's the vaccine that's going to stop you from getting hospitalized or dying from COVID. And that's taking a bit of a step back, Mike. That was another thing that during the COVID pandemic, and another lesson to take out of here is looking at that. What went wrong there? So the government, essentially, if you remember in the pandemic, at one point they said, if you have the vaccine, you don't have to wear a mask anymore. The premise there being if you have the vaccine, then you can't spread COVID to somebody else, which was completely wrong and the scientific community knew this was completely wrong, but the president had gone on and said this, and so they're trying to back him up. Ideally, they would have gone on and they would have said, no, that is incorrect. This will not necessarily prevent you from spreading it to somebody else, but it will prevent you from dying of COVID, which is what vaccines are made to do, or getting hospitalized from COVID. And so getting that emotional level, but correcting that misinformation at the same time is important. So again, trying to counter these as best you can, trying to counter them with information, but also understanding they are hitting people on an emotional level. You need to try to do that as well.
Sound advice. Always difficult also for medical professionals, doctors to work with executives because on two different playing fields, in my opinion. So, and we've spoken about that before, maybe another episode there. John, this has been fantastic. Far exceeded my expectations and I appreciate you joining us. Here recently, in the last couple of episodes, I've kind of tried to close with this. So you've got an amazing history, an amazing family, an amazing experience behind you. My question is just, a little bit of advice or expertise from a graybeard, as we both are.
And first off, Mike, I dye my hair like this just because it makes me look definitely graybeard. Been around for a long time. So, and I'm sorry, repeat the question again.
So if you have a close family member that's coming into the irregular warfare, our community as a whole, what solid piece of advice that you would want to give them?
The best advice I would give you is a couple of things. Number one, go with your heart. Go with what you really want to go to. And it doesn't have to be a huge calling. This is what you want to do for the rest of your life. But this is a calling you have in your life right now, because these things are not easy steps to take. None of them. If you talk to the people in this community, they have made a lot of sacrifices to get to where they are and to do the things they've done over the past few years. They've done tons of good, especially when you look at the world perspective on things. But at the same time, it comes with some sacrifices. And so it should be a calling for you. At the same time, realize that this is not the only thing in the world you can do. You can certainly do this, use it as a stepping stone to do other things as well. And if you talk to, as Mike mentioned, the graybeards in this community, they have all done multiple things, and they started off the boots on the ground person doing the regular conventional work, going into SF, doing SF work, now doing IW, UW kind of stuff, and moving on from there to do other things as well. You can do good in any of these environments. You just need to make sure that you stick to your ethics, you stick to your beliefs, but you're also willing to listen to other people and change the thoughts you have based on the information you're getting from other people. Because I always tell people, one of the big things I try to do is, particularly in the media, is I never delve in absolutes. Because the second I delve in absolutes and say, this is absolutely the information, it's not going to change, 2 days later it changes, because that's how science works. Science is messy and science changes all the time. And so the same goes with these other situations, these other things you're doing. What we might be doing today might be completely looked upon and frowned upon 3 years from now, and we're doing something different. So you have to be willing to be able to do that, willing to adapt. But at the same time, it's a bit of a cliche, but have fun. Do something that you're really going to enjoy, do something that you're going to have fun at. And if it starts getting to the point where it's not as much fun, switch to something else. And that's what I've done throughout my career. Again, went from pilot, went to then doctor, then went to news, because I was having fun in all these situations, but I was also taking it very serious.
You only live once.
That's it.
Yes, sir. John, Dr. Torres, thank you for your time and thank you for your insight today, sir. We appreciate your continued impact, both within the community and writ large. The best to you and your family, sir.
Same here. Talk to you later,
Yes,
Mike.
sir. Ladies and gentlemen, thank you for your time and consideration in this concept of medical messaging. I hope we've noted that we all have to understand and appreciate the subject fully all the time, and also work more as a team, especially in staff functions, for medical messaging and campaigns and strategy. The very best to you, to your work and families, and to our efforts in solving these very complex challenges. Thank you for listening to this MSIW program, and we hope that you will both participate and contribute to the notes or offer thoughts, requests, and suggestions via our email link. The best to you, your work, and the relationships and security this effort strives to impact.